You don't have any idea how many Americans died from COVID?
It was one of the most explosive hearings Capitol Hill has seen in years. Health Secretary Robert F. Kennedy Jr., 7 months into his tenure, faced a Senate grilling that stretched over 3 hours. Senators from both parties tore into him over vaccines, public trust, and his sweeping changes at the Centers for Disease Control and Prevention. Democrats accused Kennedy of spreading mistrust. Republicans who once backed him sounded alarmed, and the entire spectacle raised questions about whether he can continue in the role. From the start, vaccines dominated the hearing. Kennedy has narrowed access to COVID shots, canceled $500 million in mRNA research, and fired the CDC's Vaccine Advisory Panel, moves that senators warned will cost lives. Democratic Senator Ron Wyden didn't hold back, calling Kennedy a danger to Americans' health. Senator Elizabeth Warren accused him of lying in his confirmation hearings, after he promised not to take away vaccines, but later cut off access for millions under 65.
You canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were?
Do you think they were perpetrating a hoax yesterday?
Perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health. So you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans.
Republican doctors, like Louisiana's Bill Cassidy and Wyoming's John Barrasso, voiced similar frustration. Cassidy, who had cast a decisive vote to confirm Kennedy earlier this year, said his policies are effectively blocking access to life-saving shots.
You appointed him to this panel?
Dr. Malone is one of the as I said, Dr. Malone is one of the inventors of the mRNA vaccine. So he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
the obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel.
The sharpest attacks didn't just come from Democrats. Republicans who once stood with Kennedy are now questioning his credibility. Senator Barrasso reminded him of his pledge to uphold vaccine science. Senator Tom Tillis called his firing of CDC Director Susan Monterez contradictory and troubling. At the same time, both parties tried to pit Kennedy against Donald Trump. Senators repeatedly highlighted how Kennedy dismisses the very mRNA vaccines Trump rolled out under Operation Warp Speed, one of Trump's proudest achievements. Kennedy praised Trump's leadership while calling those same vaccines unsafe.
Senator Bill Cassidy said effectively we're denying people vaccines. Do you have full confidence in what RFK Jr. is doing?
Well, I didn't get to watch the hearings today, but he's a very good person. And he means very well, and he's got some little different ideas. I guarantee a lot of the people at this table like RFK Jr., and I do. But he's got a different take, and we want to listen to all of those takes. But I heard he did very well today. But it's not your standard. It's not your standard talk, I would say, and that has to do with medical and vaccines. But if you look at what's going on in the world with health, and look at this country also with regard to health, I like the fact that he's different.
The clash over vaccines has been amplified by Kennedy's purge of the CDC. He fired Director Susan Monterez less than a month after she was confirmed, then forced out 4 senior officials who objected. Thousands of employees have left, and morale is collapsing. Monterez has accused Kennedy of ordering her to pre-approve vaccine recommendations that contradicted science, a charge she's willing to repeat under oath. Kennedy called her a liar, doubling down under questioning.
My first question, Mr. Secretary, is did you, in fact, do what Director Monterez said you did, which is tell her to just go along with vaccine recommendations, even if she didn't think such recommendations aligned with scientific evidence?
No, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay.
If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you.
And I need to fire some of those people to make sure this doesn't happen again.
Created as a result of your ideology.
The Congress has been investigating
all over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong, too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Maybe you're listening to a selective group of people.
Well, you get me.
And I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
Senator Maria Cantwell called Kennedy a charlatan. Senator Maggie Hassan accused him of making up data. Senator Mark Warner pressed him on basic facts, like how many Americans died of COVID, only to hear Kennedy say he didn't know. Senator Tina Smith cut to the chase. If Kennedy once told the committee he wasn't anti-vax, and later told Americans no vaccine is safe or effective, then when was he lying? Kennedy's reply, both things are true, stunned the chamber.
Families are confused. They're scared about who to trust about their health care. Robert Kennedy and Donald Trump have done so much to feed that mistrust. Every single day, there's been an action that endangers the health and wellness of American families. Robert Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people.
Despite the barrage, Kennedy remained combative. He accused senators of making things up, called questions gibberish, and dismissed criticism as pharma propaganda. He said his purge of the CDC was necessary to fix an agency that failed Americans during the pandemic.
I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic disease has reached crisis proportions in our country. And finally, we have an administration that is taking action. The Maha Report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. Gas station heroin, electronic cigarettes, drug prices, prior authorization, information.
Senator Kenny, those private authorizations are hard to get. It takes over 3 months to get a prior authorization. Senator Kennedy, do you know some people will die between those 3 authorizations? You're killing millions of people. Prior authorization takes too long for some people to be able to.
Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving.
The hearing wasn't only about vaccines. Senators also clashed with Kennedy over Trump's One Big Beautiful Bill, which slashes Medicaid. The Congressional Budget Office estimates nearly 8 million Americans could lose coverage. Kennedy insisted there were no cuts, but lawmakers warned hospitals will close and families will lose care. Republicans pressed him on rural health funding and the stranglehold of pharmacy benefit managers. Kennedy promised to back reforms and claimed rural communities would see more money, but senators from both sides were skeptical.
President Trump and Secretary Kennedy have made a steadfast commitment to make America healthy again. Under this administration, HHS has placed patients at the center of the healthcare system, empowering them with the tools and information they need to create a healthier future.
By the end of the hearing, Kennedy had alienated Democrats and rattled Republicans. His critics said he is undermining Trump's biggest achievement, fueling vaccine distrust, and throwing the CDC into chaos. Supporters said he is finally tackling chronic disease and exposing pharma's influence. But the takeaways were clear. More investigations are coming.